Okay, so next we're moving on to is the slump test. So this is on page 244 if you're following this on your book, and this is a test for a herniated disc. Now again, this is done in different stages, very similar to the straight leg raise we're going to do supine. So if at any stage that the client feels pain or feels anything generating throughout the body, that's where you stop your assessment. You don't keep going with the next points of the assessment if the client is already listing pain. So there's your positive test already. Okay, so the slump test is exactly as it says. We're going to get the client in a slumped position. So first you're going to ask your client to take their chin to the chest. You're going to ask them to round the shoulders and come forward. So you're trying to create this bend and stretch through the back. From here, have you any pain, any things bothering? No. So we're okay for the client to move on. Now we're going to straighten one leg. So we can start with the left leg here. So straighten the leg. Again, have we any pain here? No. We've no pain. We can move on to the next part. Can you bring the toes back towards you? Slightly bend the knee, just so you're not pulling on the back of the knee there. And again now, have you any pain? No. We're still getting a negative here. So the last part is, can you bring the head up as if you look at the ceiling, but don't come back too far? Now, have you any pain? No. Excellent. So relax the leg, come back into a neutral position. So now we have a negative. The client is not eliciting any pain, but we have done it in different stages. So this is the slump test. You repeat it then on the opposite side. If the client did say they had pain, you would stop. You'd ask them to describe the pain. Is it sharp? Is it pins and needles? Where is it travelling through? Where are they feeling the pain? Is it on the spine? Or is it muscular, maybe QL on either side? So a lot is what you're asking the client, where do they actually feel the pain? Okay, so from here now we're going to move on to the leg length test. Again, this is just checking for an imbalance in the pelvis. So getting the client to lie supine, so lie on your back, head up there, feet down here for me. So you get the client to relax, okay? Now from here, what you're checking to see is there any shift going on with the client? In other words, is there a shift on the pelvis from side to side? Which then would tell us, because one leg would seem longer than the other. Now, there is some conditions where a client is born or has had something traumatic or had surgery where they do actually physically have one leg longer than the other. But you would have ruled out that by asking the client anything in their medical consultation. So what we're looking for here is to see, is the pelvis in alignment, which then tells us, is the sacroiliac joint in alignment. So client is nice and relaxed. Nice big deep breath in for me. And client relaxes. So I'm going to take my thumbs and find the medial malleolus. Okay, so I'm just going to take down the socks just a wee little bit there. And I'm going to find the medial malleolus on each side. Now it doesn't matter if you put your thumbs on the malleolus, just above it or just below it, as long as they are same on both sides. So once you've found the medial malleolus, you're going to bring the feet together. And what I'm looking for here is, are my thumbs in alignment? So in other words, is the medial malleolus in alignment on either side? So if you've noticed that one thumb is a little bit lower, well then we have a shift going on this way in the pelvis. Okay, so this is our leg length test for our SIJ dysfunction. So the next one we're going to do is the piriformis test. Okay, so the piriformis test, you don't really want to tell your client what you're looking for, but you just want your client completely relaxed. So I generally give the legs a bit of a shake out, okay, and then just drop the legs. Now what we're looking to see is, what is the angle that the feet come out at? So generally what we're looking for is, we don't really have toes that are pointing dead straight upwards, we want a slight angle outwards. But what you're not looking for is, you're looking for extremes of external rotation. So the external rotation is actually coming from the hip due to a tight piriformis on that side. So again, a bit of a shake out on the legs, ask your client just to completely relax, and you're looking to see what happens to both feet. So in Poppy's case, her toes on her right hand side are pointing straight up to the ceiling, but on the left hand side are slightly out. It's the slightly out that I would say is quite kind of normal, because we do have about 22 degrees, which would be just an average tilt. Again, the fact that she's staying dead straight on this side tells me that there is a little bit of tightness going on this side as well, which also fall in line with what we noticed on the Gillett test earlier. Okay, so that is our piriformis test. Now the next one we're going to do is the straight leg raise for the herniated disc. So this is a bit like the slump test, but just done in a supine position as well. And also this one targets a little bit more on the lumbar spine as well, where we tend to have kind of issues going on, lumbar or neck going on with discs. Okay, again, this test is done in 3 stages. If at any stage the client tells you that they have pain, then you stop and there is your positive for pain. Okay, So we're going to start with poppies on the right side here. So first of all, what you're going to do is you're just going to try and keep a straight leg there, but don't lock out on the knee. So we're going to take up the leg just to a raised position. So we got a bit of hip flexion going on here. Have you any pain? No. Client has no pain. So I'm now ask the client to hold the leg themselves just for 3 seconds. 1, 2, 3. Excellent. Relax the leg. Did you have any pain holding it yourself? No. Perfect, which means we can move on. So now we're going to do dorsiflexion with the foot. Have you any pain there? No. Again, I'm going to ask the client to hold this herself. So 1, 2, 3. Relax the leg. Nice ask them to relax in between as well, just in case a client has an injury or is in pain. You're not causing them too much trauma. Did you have any pain when we moved the foot? No. Excellent, which means we're free to move on to the last part. So we have the leg raised, we're in hip flexion, we're doing our dorsiflexion, toes pointed towards the head, and now we're going to ask the client just to raise their head and shoulders as if they were going to look at their toes, but hold the leg as well themselves at the same time. So you ready? There you go, and 1, 2, 3, and relax. Did you have any pain? No. Excellent. So again, we have a negative for this one, which is fantastic. If a client said, yes, I do have pain, again, it is really important that you stop and say, where exactly is the pain? Can you describe the pain to me? What does it feel like? And is the pain travelling anywhere, which may be indicative of an impinged nerve as well? So these are little kind of questions that you can ask in between. Okay, so that is our straight leg raise.